At this time, I'd like to introduce Dr. Epke. He's going to talk to us from a health standpoint about the do's and don'ts.
Good afternoon. I'm Dr. Epke. Some of you probably know me. What I wanted to talk about just a little bit is what makes prescription drug abuse dangerous. These medications that are drugs of abuse, like narcotics, medications that we classify as brain depressants, like Valium and sedatives, things like that. Alcohol would be included in that. Stimulants like Adderall, like Ritalin, some of which I may prescribe for some of you sitting here. All of these things have their effect by changing the concentrations of chemicals in your brain that serve as transmitters of signals from one neuron to another. And there are a lot of benefits that can be derived from manipulating those things. Control of pain, helping people to focus, helping reduce anxiety, helping depression, things like that. But these medications mostly are controlled medications, and the reason they're controlled is because they are dangerous. When I prescribe a medication for somebody, I take a lot of things into account. Size, kidney function, liver function, what other medications someone might be on, what other health problems that they might have. And all those things go into determining what's a proper medication, what's a proper dose for somebody. When you're taking somebody else's medication, there's nobody watching out for you to determine that that's not an unsafe thing for you to do. And then a lot of times these are taken in combination with alcohol, and the combination of alcohol alters how that medication works and affects what kind of a response that we have. In Melanie's case, probably either the alcohol alone, perhaps the medication alone, probably wouldn't have been enough to kill her. But the combination of those two things it was enough to make her stop breathing. The other thing to keep in mind is that these medications, when people are taking them on an ongoing basis, people become tolerant to them, and they need larger doses of them in order to make them work. People that have chronic pain conditions, sometimes we prescribe narcotics for because there aren't other medications that are effective. And it's very common for your body to get used to having that medication in. Your body metabolizes it faster. You need larger doses of it in order to have that effect. And so if you take somebody else's medication, somebody that's been on a medication like that for a period of time and has had to have that dose adjusted up over a course of time, that dose or that amount of medication for you could be fatal. A couple of really good examples that I can think of. I have had what I would call a little old lady, and by little she was about 85 pounds, and she had colon cancer. She'd been fighting that for a couple of years. She'd been on narcotics to help her with the pain from that. She was on doses about 8 to 10 times what we would prescribe for a young, healthy individual that had come in for an acute injury. And if somebody had taken that, that would be enough to cause them to stop breathing and die. I have another gentleman that I prescribe pain medicine for. He takes literally enough to kill a small horse. And so you don't know when you're taking somebody else's medication what the circumstances of their use are, and it can be very, very dangerous. Some of the things we also see from some of the medications like stimulants, stimulant abuse is fairly common. In college, people use stimulants to try to pull all-nighters and things like that. But it's not unusual for people to have things like paranoia develop, where you think people are out to get you, or for people to have hallucinations and things like that. These medications can have those kinds of effects. So I just want you to be aware of the fact that these medications are dangerous, even though they're prescription medicines, and you think, well, you know, it's not like I'm going down and doing meth or going down and getting heroin. Yeah, there's good quality control and that sort of thing, you know. But these medications are dangerous, and when you use somebody else's medications, you're taking a very big risk. Another thing that I would encourage you to do, because a lot of you out there might not be in that situation, but you might be in a situation where you're someplace and you notice somebody that you know that has maybe made some poor choices. I think of somebody that I admitted to the hospital during this last year, that if it hadn't been for somebody, a friend, watching their back, they noticed that they seemed to be, you know, pretty out of it. If they hadn't called the ambulance, the person would probably be dead now. So remember also to watch out for each other. So I didn't mention one of the other reasons that I'm standing here is that I had the opportunity and I had the privilege of being there when Melanie's baby was born. You know, and that's something that I really enjoy. The miracle of birth. But I look at those pictures and I think of all those pictures over the next 50 years that she might have had if she hadn't made that mistake. I'd have a hole right where Melanie would be. So don't make that mistake.